Breast augmentation, people will ask about that. It's the most common thing we do in plastic surgery, breast augmentation. The typical patient looking for breast augmentation is a lady that doesn't feel bodily proportional. She feels like the breast doesn't match the waist, doesn't match her hips. That may be just from not developing in that area. And on the other hand, it may be from having had breast tissue when you're 18, 19 and had several kids and lose the breast volume, and then before you know it, you don't have any breast volume there anymore. So breast augmentation is a great way to restore breast volume and to give a patient the curvature, the confidence of feeling feminine. Many women don't feel feminine from the lack of breast tissue. And so if you can add that, you can help a lady's self-confidence, you can help her self-esteem a lot. I oftentimes tell patients, plastic surgery is a great way of getting rid of problems in your life, little problems. It's not something that I recommend patients get addicted to or they do over and over and over again. I think it's something to identify a problem that you have and be able to address that, and you move on in your life. And breast augmentation is a perfect example of that. Ladies feel like they're not in proportion, and they can get that proportion delivered with a breast augmentation. 4 basic decisions a lady needs to think of when she's considering that procedure. Number 1 is what type of implant. We use silicone or saline. In today's world, we use about 80% silicone and about 20% saline. And the next thing that we talk about is what incision to use. If a lady does not need a breast lift, we usually make the incision under the breast. Now, in the past, we used a lot of periareolar incisions, but we're seeing statistically that the risk of a periareolar incision for capsular contracture is a lot higher. So almost exclusively, we're using an under the breast inframammary crease incision now for breast augmentation. And that goes for most plastic surgeons in the United States. Third decision is where to place that implant. We usually place it under the pectoral muscle. That has a lot of advantages. The rates of capsular contracture are a lot lower when we put it under the pectoral muscle. Also, there's a smoother takeoff off the chest wall coming from the top down when it's under the pectoral muscle. The disadvantage is you do feel a little contractility when a patient has that implant underneath the pectoral muscle and they flex maximally. They may feel that implant rise up a little bit. For most women, they get used to it, and it becomes something that they don't think about on a day in, day out basis. But for others, or at least for most women, it is the better place to put the implant because of all the other advantages that you experience. Fourth decision is size. And there are some things that a lady needs to think about when she's trying to decide what size is good. We use the analogy of decorating your room. If you've got a big wall, you need a little bit of bigger picture on that wall. And if you've got a small space, you put a small plant in that corner. Bigger, broader shoulders, wider chest needs a wider implant because you need to fill that up so that a woman looks appropriate in the midline, her chest wall is filled out horizontally. And then we vary the projection on the implant according to the patient's goals and what they're looking for. So that's something that we go over in the consultation when a patient comes in. We review with them their goals, what they'd like to see, what type of implant and what size of implant will meet their body frame.